Hi, I'm Vina Tran. I'm a dental hygienist and a myofunctional therapist at Green Dental Medicine. I work together with Dr. Green to provide myofunctional therapy in conjunction with Vivos. An orofacial myofunctional disorder, or OMD, is a disorder where the orofacial musculature interferes with the functions and normal growth of the face and the mouth, which can affect the lip-tongue posture. It can also affect breathing, speech, swallowing patterns, along with abnormal skeletal development of the mouth. Some of the signs and symptoms of OMD include the tongue pushing forward past the front teeth, or chronic open lips, speech distortion, dental abnormalities such as overjet and overbite, abnormal tongue rest posture, drooling, as well as mouth breathing. OMD can be caused by many factors. Some of these include blocked nasal passages due to large tonsils or adenoids, and allergies, which can make them breathe through their mouth instead. Myofunctional therapy is an exercise-based rehabilitation program used to retrain the orofacial muscles. It is a highly effective therapy to help strengthen the muscles of the tongue, lips, cheeks, and the mouth to optimize the development of facial structures, as well as improving nasal breathing, tongue posture, chewing, and swallowing pattern. There are four main goals that we want to achieve in myofunctional therapy. The first is nasal breathing, which is beneficial because it can increase oxygen absorption and help fight infection. The second is lip seal. When you have improper lip seal, you tend to breathe through your mouth more, and this can cause dry mouth, lead to gum disease, and increase cavity risk. And third is correct tongue posture. So when the tongue is in proper position, it can help to stimulate the jaw to develop optimally, giving your mouth enough space for your teeth to grow in straight. And last is proper swallowing pattern. When you have an incorrect swallowing pattern, your tongue is thrusting forward or sideways or laterally, pressing against the teeth, and can cause them to flare out. This in turn over time can create occlusal abnormalities or teeth misalignment. Orofacial myologist, also known as myofunctional therapist, is different from speech pathologists in that the orofacial myologist focuses more on the muscular functions and stability of the mouth, such as the jaw, lips, tongue, and cheeks, whereas speech pathologist focuses more on the learning and the cognitive concerns associated with sound productions and articulation. However, they do work together synergistically because there's a high incidence of speech issues in patients who exhibit orofacial myofunctional disorders. Your child can benefit from myofunctional therapy if you notice any of the symptoms, such as drooling, the tongue pressing against the front or back teeth when swallowing or at rest, if they keep the lips open or having a hard time breathing through their nose, if they tend to have facial distortion and require a lot of effort to chew and swallow. So for example, one of my patients, an 11-year-old girl, came in with an inverted lip where her upper lip flared out and she can't breathe through her nose. So some of our goals with this patient is to work on strengthening her lip and her tongue. We wanted to strengthen her lips so that way we can help to roll down her lip to have a better seal. This way it will help her with better breathing, better nasal breathing, and reduce her risk of getting cavities in the future.